evening, everybody. Not good enough. Good evening, everybody. Thank you. I like hearing that. Way to go. Way to go. Thank you. So for those that don't know me, my name is Stuart Schlossman, and I want to welcome you to this event, being our second annual Memorial Neuroscience and MS Views and News partnered multiple sclerosis learning program. So I want to thank you all for being here. I'm sure that they appreciate it as well. All right, this event is solely sponsored tonight by Memorial Neuroscience, okay? And they're doing this because they want you to learn what it is that they have to offer the MS community. They have things that, if you're seeing other neurologists or general neurologists or otherwise, if you're living out of this county, living in another community, this is something that you might find interesting, whether it be with tonight's speakers or in general, everything that they have to offer from this comprehensive MS Center. I said that wrong. It's supposed to be comprehensive in the quotes, not the quotes before comprehensive. We do have 3 presenters tonight. The first one is Miriam Ross. I'm going to ask her to come on over. Miriam Ross is a board-certified family nurse practitioner. She's been with Memorial for a year coming this summer. She's a nurse practitioner. She's a multiple sclerosis nurse with the International Organization of MSRNs, and she also works with headaches. She's a headache specialist. But she's going to speak with you for approximately 10 minutes, and she's going to be speaking about
communicating with the healthcare team.
Communicating with your healthcare team, okay? So let's give her the mic, and we'll get going here. Thank you.
Thank you, Stuart. Good evening, everybody. Is this okay? Okay, so welcome everybody. I'm happy to be the first presenter to welcome you all here tonight. I see some familiar faces, I see a lot of unfamiliar faces. Just as a disclaimer, this presentation does focus somewhat on our team at the Memorial Neuroscience Institute, but that doesn't mean that it's unique to us. It's just in sharing what we do at an MS Comprehensive Center. The best way to do that was to give you some specific details. So let's see if I can use this. Okay, I did it. So right here, treating multiple sclerosis. Most of you in this room know it's an interdisciplinary approach. It requires a lot of different people in order to treat this disease and in order to manage it appropriately. So specifically, what we do is we work with our entire staff within the Neuroscience Institute. Everybody has a role in providing care for our MS patients. But in addition to that, we work with multiple other physicians. We work with Spasticity Clinic, the physical medicine and rehab doctors, the physical therapists, occupational therapists, urologists, ophthalmologists. We have Dr. Brose is our neuropsychologist in our office, so we work with her, and Dr. Santo is our psychologist. And we are now referring patients to the nutrition center, as well as we work with the infusion center, where a lot of our patients get their infusions and have their medications administered. So it takes a lot of people to take care of the MS patient. Specifically at the Neuroscience Institute, when somebody comes to our office, there is Dr. Subay is our MS neurologist. I'm the MS nurse practitioner. We have multiple medical assistants, secretaries. Loriano, who's here tonight, who you might have seen at the table, is our patient navigator. And Chris Garcia is our practice manager. And as I mentioned before, Dr. Brose and Dr. Santos work with our team as well. So while Dr. Subay is the MS neurologist, and he works very tirelessly and diligently to ensure quality of care for every patient, there's only one of him. And thankfully, we have an expanding practice. We are growing. So that's kind of where I step in, and I'm able to be available for our patients. I'm able to be in contact with our patients via phone, MyChart messaging, for office appointments, specifically for more emergent appointments where somebody might need to come in. I'm usually available to see patients pretty quickly. So I think it's great that I'm available as well to to be there as a source of access to care for our patients, and I look forward to working with everybody that I haven't met yet. As I said before, our MAs, everybody's role is so important. So our MAs will be the ones that you see, they triage you when you come into the appointments. They're also behind the scenes working on your prior auths for your medications. So we can all appreciate how tireless that job can be. And they're available for medication refills. They help to ease that process. The secretaries, again, a lot of you know the secretaries in our office. They work very hard to get referrals in place. They work to get you set up at the infusion center. And really anything that's a part of coordinating your care, they're pretty much involved with. And Laureano, if you don't know him already, I'm sure a lot of you will get to know him. He works tirelessly to get records from other physicians from other areas that we might need them, and he's able to bring in those records for us and works with you to get everything that we need in order to ensure that your visits are meaningful and that we are able to accomplish what we need to do at the visit. Okay, so this talk in general is a little bit different. It focuses kind of on what to expect when you come to our office, how to prepare for that, and you know, how we can make that visit either with myself or with Dr. Soubey most meaningful. So the first thing is we want you and us to be prepared for the visit. What that means is if you're a new patient coming in from outside, any records that you have, and this is what I had alluded to before, any records that you have are greatly appreciated. Anything that we have ahead of time that we can review ahead of time will allow us to truly make the visit the most meaningful. The more information we have up front, obviously, then the more we know before we even sit down and meet with you. On that note also, for MRIs and imaging, if you have them done at Memorial, then we have everything in the system. But if you get them done at outside facilities, which is completely fine, and some insurance providers will only approve it at other facilities, we do request that you bring us discs. And that's because, as a lot of you know, we open up the images with you, we review them with you, and we want to have those before the visit so that we can review them personally in addition to looking at the report. And for the report, always request that they send it to us as well. Okay, before you come to see us, it's exciting because hopefully we'll be able to help you and help manage symptoms and go in the right direction in order to really managing this disease. But it could be nerve-wracking also. Everybody wants to get the most out of their visit. They want to make sure all their questions are answered. So be prepared. Bring a list of questions. Bring a list of symptoms that you want to address. The more we speak about your questions up front at the beginning of the visit, the more time we'll have to address all of the questions. So I always recommend asking questions at the beginning and not waiting until the end when we might be rushed for time. On that note also, any symptoms that you're having, write them down beforehand. Anything that you want to go over really is the best to do at the beginning. That being said, we might not be able to in-depth address every single topic. And if we're not able to do that in one visit, we will always make a follow-up and ensure that we are able to address everything at a future visit. So part of getting ready for your visit, and I'm going to thank Stuart for this. I don't know where he is because it's hard to see. But up on his website, so this is, okay, so right up on the MS Views and News website, that information tab, he has this MS review of systems or questionnaire that you can bring with you and, or, you know, fill it out at home before you come so that you have everything organized and on a visual tool. Now, this isn't the only one. You can write everything out freestyle if that works for you as well. But I did want to point this out because I think this is a great tool. Okay, and on that note, we do typically ask about these symptoms at the visit. So I wanted to bring them up on a slide here because a lot of times patients will look confused if I ask them about a certain symptom. They'll say, no, I don't have an issue with that. I'll say, great. I'm not looking for issues with all of these symptoms. These are typical areas where MS patients do tend to have more trouble with than others, but that doesn't mean that every patient is going to have trouble with all of these symptoms. That being said, you might also have a question about a symptom that's not on this list. Again, that's also completely fine, and we're here to address any symptoms you're concerned about, whether they are typical for MS or not typical for MS. So just very quickly, energy and fatigue during the day, sleep disturbances at night, cognition, issues with memory, with your thought processes, not being able to find the right words when you're speaking. Pain, we all know, is a big issue. Depression or any other mood alteration. Visual disturbances, gait disturbances, so difficulty with walking, and that leads into falls. The muscle spasms and the nighttime cramps that tend to be seen. Any issues with bowel or bladder, and any type of sexual dysfunctions. So we welcome you to discuss any of these symptoms with us, and it's our goal to help you manage these to the best of our ability. Okay, this here, without any patient identifiers, is a example of our after visit summary. So once we go through all of these symptoms and we come up with a plan to treat them with, we want to make sure that we're all on the same page, that we all know what the plan is, and that we're able to follow through with that plan. So going back to what I said, that these visits can be overwhelming. These visits can definitely include a lot of information in them, and I don't want you to be concerned during the visit about getting everything down on a piece of paper. What we try to do, and we're pretty good about always doing this, is when you get your after visit summary, when you check out with the front office staff and they give you this document, the plan of care is going to be right there. Okay, so everything that we discussed is going to be on there. So we're going to discuss your DMT, your other medications for symptoms, what other physicians or other specialists we're referring you to, and when to follow up. So I think this is a great tool, and I know that for myself, this would alleviate a lot of pressure if I knew that somebody was going to tell me exactly what we discussed and what the plan is moving forward. All right. So another part of communication between healthcare providers, specifically with MS and patients, is relapses. Relapses is probably the most scary aspect of dealing with MS. Is it a relapse? Is it not a relapse? What do I do if it's a relapse? How do we approach it? So having this information isn't necessarily going to make it less scary. It's just going to help you understand a little bit more about what the process is. So we all know MS is a chronic disease. Treating the MS, slowing the progression of the MS, is something that we typically do long term. Okay. We also, as we discussed in the previous few slides, we try to treat your symptoms. Okay, but then we need to treat acute relapses, and those will come and go. Those happen sporadically. We can never predict when a relapse is coming, but we want to be prepared. So first thing that we do when managing a relapse is we have to rule out anything else, okay? Fair and simple. We need to make sure that you're not having, most likely culprit is an infection that mimics a relapse. Other things that mimic relapses, a lot of our patients are aware of their own mimics, but heat exacerbations or anything that can cause you to feel like you're having a relapse again. But what we want to do from our standpoint is make sure, do you have an infection, or is there something else going on? I'm sorry. Okay. When we rule this out, the infections, we're gonna try to do everything outpatient. We don't want to rush anybody to the emergency room unless there's a real need to. So we do try to stick to management as outpatient. A rule of thumb, not exactly, but if symptoms last less than 24 hours, it's typically not a relapse. It's when they're starting to last for longer than 24 hours that you might want to start thinking, could this be a relapse? Again, if it's symptoms that you've had in the past that are that are symptoms that you've relapsed with in the past, sometimes that could be concerning, but doesn't always mean a relapse as well. So if it is a relapse, what do? We usually treat with high-dose steroids intravenously, so it is usually done in a hospital setting. It can be done outpatient as well, Monday through Friday in the infusion center, insurance permitting and logistically permitting. So that's an alternative to having to have a patient be admitted into the hospital. If steroids are not, there are other ways that we treat relapses as well with IVIG or in severe cases with plasmapheresis. But typically, rule of thumb is steroids for 3 to 5 days. And then importantly, regarding a relapse is MRIs. We don't always rush to do an MRI when we suspect that somebody's having a relapse. When we do MRIs, we're usually doing it to rule something else out or just for monitoring so that we can see the progression of the disease over time. So we might treat a relapse without necessarily doing an MRI, and vice versa. We might do an MRI and not treat if there's no indication that it is a relapse. Okay, so again, this is just a little bit more of a visual about how we treat. We could try to do it outpatient, send you for blood work, send you for a urine sample. As I said, that's usually a very common culprit. If it's indicated clinically, then a chest x-ray, and then at the bottom there, that is actually a picture of plasmapheresis, what I was discussing before. Now, plasmapheresis is a process where they cleanse the blood out, take out all the toxic part of the blood and filter back in the essential parts of the blood. Like I said, this is only used in a very severe case, if a case where steroids aren't indicated or where patients don't respond to steroids. Okay, so moving on with our communicating. Memorial and most hospital institutions have an electronic means of communicating. So MyChart is a great tool for patients because it allows you to see your upcoming appointments, it allows you to view your lab results, to see your imaging reports, it allows you to request prescription refills, and it also allows you to communicate with us. I really enjoy using MyChart messaging for communication with my patients. I find that when things are written down in a concise way and the communication is written, then we always have it to refer back to, both for yourself as well as from our end. So I also find that things don't tend to get lost in translation when it's direct communication, as opposed to a phone call where somebody's going to answer the phone, they'll get the message to us that you have a question, we'll call back, might get a voicemail, might get a person, and then you run into phone tag sometimes. So I personally prefer the MyChart messaging. It's very simple to use. There is an app for it. And I find that it's quick, it's efficient. I can answer these messages throughout the day, as opposed to phone calls where I tend to wait until closer to the end of the day when I actually have time to review my phone calls. So not to say that that there is not a place for phone calls. Phone calls are very important. Dialogue is extremely important, obviously. But for quick questions or things that you feel it would be appropriate through MyChart, just know that this avenue is available, and it's usually a very effective way to communicate. And true emergencies obviously should always present to the emergency room. We do our best at the office to get back to phone calls in a timely manner within 24 to 48 hours, but if there is an emergency, that's not quick enough. All right, so communicating with you regarding medications. So patients take medications for multiple different reasons. They can either take them to treat disorders or to treat symptoms. When we are prescribing a medication, we're doing it with safety and efficacy in mind. So in terms of medications that treat symptoms, we want to make sure that the reason why we're prescribing the medication outweighs the benefits, outweighs the risks rather, that the potential risks that the medications come with. So ask questions about your medications. Make sure you know why you're taking it. How do you take it? When do you take it? What else does it interact with? Medication management is an extremely important part of your care, and we're here to go over that with you, to discuss your medications in any way that we can to be helpful to really enhance that aspect for you. Again, on that note, I did feel that it was important to take a few minutes here to discuss medication management, specifically when it comes to disease-modifying therapies. Now, this is neither the time nor place to discuss every single disease-modifying therapy that's out there. And, you know, I'm sure that as an MS patient, you're all very much up to date with the options available to you. But what I do want to stress is that disease-modifying therapies are not cookie cutter. They are not one size fits all. There are 14 disease-modifying therapies out there. There's more on the way, and there really is a medication out there that suits each individual patient and their specific scenario. So what we try to do in the office when we're choosing a disease-modifying therapy is we talk to you about it, and we make sure that this is a medication that is a joint decision. Usually, in order to make it a little less stressful, we'll bring up a few options. We'll give you a few options that we think are appropriate given your specific case, but we would never ask you to choose on the spot. We give you information to go over. We discuss the important aspects of the medications. You take it home, you think about it, you look over it, you do your research and your due diligence, and then when you come back, we discuss it further. Most of the time, choosing a disease-modifying therapy is not an emergent activity. MS is a slow progressing disease, and it's more important to choose the right medication than to hastily choose the wrong one for your case. So just know that we are there at the office. We're there for follow-ups. We're there for you to come back and discuss again. We want to make sure that your specific treatment plan really is unique to you and that it works best for you and your lifestyle. Okay, and on that note, thank you very much. I'm a few minutes early, I do apologize.
Thank you very much.
We have plenty of time for questions.
Great. So I messed up before. I said she had 10 minutes to speak, but it was 25. Anyway, so Bill is going to be on that side of the room. If you have a question to ask, please raise your hand. Let him acknowledge that you're going to be run over to. I'm going to be on this side of the room, and I need to lose a lot of weight tonight, so hopefully many of you will raise your hands.
My question is regarding your practice in particular.
Okay.
Regarding the treatment for the relapses. You mentioned that the relapses are treated obviously with high-dose steroid at the infusion center. I'm assuming that's at your location. Do you also prescribe high steroid treatment with nurses at the patient's homes?
I can defer that to Dr. Soubey, but I don't see why we would, we don't typically do that, but I have no objection to doing that, assuming that the patient has the appropriate resources for that to take place.
I didn't hear your answer.
We've done it before, as per Dr. Soubey.
Great, perfect. All right, next question's over here.
You're the first person I heard refer to cramps, spasms as nighttime cramps, and I find that that's when I get them. And I was just wondering if that was unique to MS, or why they happen at night.
We do find that they mostly happen at night, mainly because that's kind of when everything else is quieted down, and when you're resting or sleeping and you're able to really focus on it, the body kind of slows down at that point. So it is typical for them to come at nighttime.
And also, I get very frequent migraines, and I was wondering if you have any experience with Botox for migraines.
Yes, I do administer Botox for migraines.
And is that as effective as medication?
Yes, we can schedule something.
Okay, thank you.
Any questions down there? Right here.
Oh, when we're ready to visit your office, which I will be next month,
okay, great.
Do you want the records from most recent to the oldest, or from oldest to most recent?
Just give them all to us, and we'll sort it out. I mean, it doesn't need to be coming to us in any certain order. It usually gets sorted in the system from our end the way it needs to be. So as long as we have the records, that's what we need.
Okay.
Thank you.
Hi, thank you. In regards to the cramps, is Gatorade suggested when there's cramping?
I don't believe that there's any specific evidence that Gatorade, are you asking because of the electrolyte component?
Right.
So I don't know that it has enough electrolytes in there. I know that magnesium is usually a culprit with cramps, but I'm not sure the efficacy that with MS patients, we usually would prescribe a muscle relaxant.
Miriam.
Yes.
I appreciate you discussing about relapses.
Thank you.
This is the first seminar that I've been to that has been addressed, because so many times you go and they say it wasn't a relapse because it wasn't 24 to 48 hours. So I appreciate the information up there and letting people know that it is very prevalent to everybody. Thank you, Miriam.
When I go to the doctor, I am going in need of his advice. I don't want to go there and have him say, well, what do you think? I don't think we should discuss. I think I'm going there for his knowledge.
That's a good point. I'm happy to address that. What we do in terms of the disease-modifying therapies is we choose therapies that are appropriate for each individual patient for their disease process, for how advanced their disease is, both clinically, radiographically. We look at that before we give you options. And once we're giving you options, it's because we really feel that the best treatment is the one that you're going to be the most comfortable with within that frame.
Okay. So you do decide which is right first.
We don't give you 14 options, typically.
Okay.
Any other questions? Everybody knows it all? I got one over here.
Hi, I have a simple question. Do you have other locations that you could see an MS patient?
Yes, at Memorial West in Pembroke Pines on Flamingo. Yeah. Yeah.
If someone that does not have insurance wants to visit your office, does your office have some sort of program, or is it perhaps linked with perhaps a source within the county? Or I don't know if Stuart knows. I think someone told me tonight that Stuart may know of not the MS Society or the MS chapter or something like that, that there may be of a program that might help someone that does not have insurance but is or has already been diagnosed and or needs to actually see a neurologist and continue care, be on some sort of medication or treatment for MS. Specifically, do you guys offer that at your office?
So because we're part of the Memorial Healthcare system, we take the Memorial insurance, which is available to patients who are appropriate for that type of insurance. And if I'm not sure if you are or aren't, but that's one solution. We do recommend that our patients have insurance because with MS comes a lot of expensive healthcare expenses, but we have also worked with patients that do not have insurance in the past.
Okay, next one here. You ready? She's got to swallow, wait. Oh, that's the trouble. She almost choked. Anybody else got a question while I'm standing here? Nope. Okay, now you got to ask.
Oh, okay. I'd like to have some information about the insurance. That where can I get the type of plan that your program accepts? I am under Humana Medicare, and I call your office and I was told that it's not in the program.
Correct. Humana is actually one insurance that we don't take. We do take most commercial insurances, as well as obviously Medicare, Medicaid, and the Memorial Plan. Okay.
Thank you for your talk. How did you come to be interested in working with multiple sclerosis patients?
Honestly, it kind of fell into my lap, but nonetheless, I do truly enjoy it. It is a passion of mine. I've had a wonderful learning experience as well as professional experience in the short time that I've been doing this. And I look forward to continue working with my patients and to continue helping to develop the field. Thank you.
Any other questions out here? Well, thank you, Miriam Ross.
Thank you very much.
We want to thank everybody for coming here. We want to again thank Memorial Neuroscience for partnering with MS Views and News to do this program. And of course, I have to thank all of you because we couldn't do this without you. Thank you.